The apex of the heart, or the apical border of the heart, the apex. So expected, this one would be the ventricles of the heart. This would be the atrium. Okay. How do you know it's anterior or posterior ang heart? Although, ibanagin mo this more the inferior, kaya apical man siya, di ba? More sa inferior. How would you know it's anterior or posterior? You just try to observe your pulmonary trunk. If the pulmonary trunk is more founded and is more than your side, behind, so at the back. So behind that would be posterior. So asa nag-arise ang imong pulmonary trunk, that would be more the anterior. Okay, so this would now be the anterior. Then ventricle mo na siya. So between the two ventricles, you have a certain groove there. We call that groove now as your interventricular groove. Since this is anteriorly, so you have the anterior interventricular groove. Posteriorly, you still have a groove there. So we call that groove now, since posterior side man siya, as posterior interventricular groove. You still have other groups between the atrium and the ventricle. We call this groove now as your atrioventricular groove. Ano? Okay, so let's discuss first the external surface of the heart. So this one, ano siyang dunggan-dunggan sa imong atrium. So these are now your auricles. So this would be your right auricle, this would be your left auricle. Okay, so a while ago we have mentioned this is pulmonary trunk, this left pulmonary artery, right pulmonary artery, ascending aorta, superior vena cava. Okay, further posteriorly you have this one. So these are now your pulmonary vein. So this would be left pulmonary vein, this would be your right pulmonary vein. Ano siya? Pulmonary vein siya. It's more found below sa pulmonary artery. Okay, so left, right. Yun na. Okay. So other structures, if you're vena cava na. Okay, for those mga arteries that's found at the walls of the heart. Okay. So from your ascending aorta, ano siya? Branch at the base of two arteries that passes through the atrioventricular groove, and we call that arteries now as your coronary arteries. So going towards the right, so kani siya, right man na siya. So going further posteriorly, so we call that now as your right coronary artery. And this one at the left, this one left, ano siya, going there. So we call that now as your left coronary artery. Okay, so these arteries have branches. Okay. At the levels of a right coronary artery, more on the inferior border na kay mo branch out, na siyang red. So we call that artery now as your marginal branch or your marginal artery. Okay, then from there it further goes posteriorly, then giving another branch at the posterior interventricular groove. And ang red here, we call that artery now as the posterior interventricular artery or posterior interventricular branch of the right coronary artery. Okay, next, your left coronary artery, nasa siya branch, chest. So at the area sa mo anterior interventricular groove, there's no branch siya. We call that branch now as your anterior interventricular artery or anterior interventricular branch of the left coronary artery. Then another branch that goes posteriorly, we call this branch now as your circumflex artery. Okay, you have your circumflex artery. Okay, here. Okay, any questions so far? Okay, next.